here with Gene Marks, one of our featured speakers at the Global Forecasting and Marketing Conference 2013 in Cincinnati, Ohio. And Gene's going to be talking about the Affordable Care Act, as well as some other government initiatives that may be of concern to small businesses. How are you today, Gene?
I'm doing okay.
So give us kind of an overview of what you're going to be sharing today here.
Sure. Well, when we talk about the Affordable Care Act, right now, as we're speaking, the Affordable Care Act doesn't really affect employers until January of 2015. So we have some time to make some decisions, but we got to make some decisions quicker than later. Most people I'm talking about are generally looking at 4 options when it comes to healthcare reform, particularly if you're running a business with more than 50 people. Because remember, if you've got less than 50 people, you're excluded. You don't have to have health insurance. You even get a tax credit mainly. So, it's people that have more than 50 employees are the ones that are affected by the Affordable Care Act. So what are they doing? Some people are just kind of sitting tight and saying, we're going to keep everything the same, and we're going to hope against hope when we get that next premium that it's going to be something that's reasonable. Other people are actually thinking of just offering the minimum plan, which is called a bronze plan. So it's an option that will be less expensive, and it will be completely legal and in compliance with the Affordable Care Act. But some employees might find that it might provide less coverages, when I say like deductible coverages and out-of-pocket coverages, than what they were getting before. But many employers are considering that. Some employers are thinking of taking the Mr. Burns approach from The Simpsons, which is like, we're not going to have any healthcare coverage at all. We're going to kick everybody out of here. We're just going to pay the penalty, and that penalty is $2,000 per employee. But they just don't want to deal with Obamacare or the Healthcare Reform Act at all, so they're just kicking them all out. So that's another option, but I don't hear a lot of employers doing that. The biggest thing that I see employers doing is considering a hybrid plan. That hybrid plan is either one of 2 choices. One is you've got your employees, you've got more than 50 people. You say to them, look, we're not going to provide health care coverage anymore. We're going to send you guys out to the exchanges where you'll hopefully have more options and more benefits that you can take advantage. However, we're going to bump up your paychecks a little bit so that whatever we were paying you before or covering for your health care, you'll get it in the form of compensation, and then you go to the exchanges and buy whatever you want to buy. It saves us on administrative fees and activities, plus at the same time it is even if we're paying penalties, it may save us some money. So that's one thing they're thinking of. The second thing they're thinking of with this sort of hybrid approach is actually having a formal defined contribution plan. Because if you've got a lot of employees, you might be subject to some type of discrimination laws. So if you formalize it and you say, look, you're working for me, I'm going to put a formalized amount into an account for you based on your level and your salary levels and your position or whatever, and it's non-discriminatory, then you use that to go out on the exchange. A lot of big companies are considering that now. So lots to think about with healthcare reform. Talk to your benefits person, but those decisions need to be made sometime soon.
Sure. So from a consumer side, we hear a lot in the news lately about these healthcare exchanges as they've been opening up. Can you just sort of explain what those are?
Sure. So the healthcare exchanges are basically like the Expedia of healthcare, healthcare reform, right? Without the travel recommendations. They're websites that are just designed so that you and I can go and buy our health insurance, and theoretically, they're supposed to be very user-friendly and help us make the decisions we need to make. As we're doing this interview, they're going through some technological issues. I realize that, and they will continue to go through technological issues because really, when has any business ever gotten their website up and running on time and efficiently? Anyway, they'll get those worked out. Looking down the road, the way the exchange is supposed to work is that you and I go there. We have lots of different choices. We can choose different levels of plans. And the theory is that they will be tied into the IRS so that if we're at the poverty level or we need government subsidies, that will be automatically calculated and built in the premium that we pay. And we pay the premium and we have our coverage. So the exchanges themselves are supposed to take the mystery out of buying your health care insurance. Right now, it's still kind of mysterious, but I think over time the education will improve.
Sure. So obviously we hear a lot of anxiety and fear from business owners about what this all means, but how could it really benefit employers?
Well, for starters, first of all, when you talk about anxiety and fear, you're absolutely right. It's just it's a lack of education because it's something that's new. The bottom line is that most employers are providing health insurance to their employees, and not only that, most of the health insurance that we're all getting, even my little 10-person firm, is providing health insurance that's beyond the bronze plan, which is the minimum requirements. You'll be surprised that most business owners will be like, wow, we've actually been doing this and doing it above and beyond what was required. So That's one thing. When we talk about benefiting employers, there's really two big benefits. One is it's providing health benefits to your employees that you don't have to worry about anymore. I mean, big things like pre-existing conditions. Say you always wanted to hire that guy and you never could because he had some pre-existing condition or had some whatever. Now you can because that's now legal by law. They can switch insurance. Secondly, if you decide to get rid of your health insurance, even have a defined contribution plan, it really cuts down on your administration. So, a lot of employers have a lot of headaches in managing the paperwork of their current health plans. So, quite a few of them are saying, you know what, enough of this. Let's, we'll give our employees a few bucks, let them go and buy it on the exchanges, and that's just one less thing we have to worry about internally. So,
Sure. So I understand there are other places where we can get your insight. You're apparently in a lot of media outlets. So
Yeah.
can you tell us where people can find more of your writing?
Sure. So, I write every day for the New York Times, and then I write once a week for Inc. magazine, Forbes, Entrepreneur magazine, the Huffington Post, and Fox Business. So you can catch me anywhere online.
Very good. Well, thank you so much for your time, Gene.
Thrilled to be here.
This has been Penny Brown with IMTS TV from the Global Forecasting and Marketing Conference in Cincinnati, Ohio.